Hello, and today we'll be looking at how anaesthesia and antiseptics paved the way for modern surgery. Previously, up until the 1840s, surgery was performed whilst the patient was awake and felt everything. Since the survival rate of surgeries was low, they were seen as a last resort. They ranged from tooth extractions to amputations. If the patient didn't die of shock during the surgery, they were likely to die from a post-operation infection of their wounds. The surgeons also had to rush procedures, since the patient could feel everything, so there was no time for more complex surgeries to be performed. This proved surgery to be stressful for both surgeons and patients. Laughing gas, nitrous oxide, was discovered by a dentist called Horace Wells in 1844. However, it only had numbing effects that still had the person aware of their surroundings, so only small surgeries such as tooth removals could be done under laughing gas anesthesia. William Morton in America found the effects of ether to be useful, as patients temporarily lost sensation and consciousness. A successful public demonstration was performed where a surgeon used ether to anesthetize a patient and remove a tumor on the left side of the patient's jaw, without the patient moving or complaining. The use of general anesthesia in surgeries led to James Simpson's discovery of chloroform, a volatile anesthetic with less side effects. John Snow used chloroform to ease Queen Victoria's pain during the birth of her 8th child, Prince Leopold, in 1853. This showed the general public that the royal family supported the use of anesthesia during surgery and other procedures that require the easing of pain. Consequently, the use of anesthesia drastically increased as it became acceptable to use anesthesia during surgery. The use of anesthesia removed the issue of painful procedures and decreased the number of deaths due to shock. But since the number of surgeries increased, the number of deaths rose due to surgical and post-surgical complications such as infections. Joseph Lister, whose first job was to replace surgical dressings, saw these infected wounds and realized that something happening in the operating room was causing these infections. He referred to Louis Pasteur's germ theory, which suggested that there are microorganisms or germs all around us that cause infection, rather than the previous belief of spontaneous generation, where it was thought that living organisms are produced from non-living matter. Lister thought that the chemical carbolic acid, which is a type of alcohol, should be used to disinfect different aspects of the operation, such as the area on the patient where the surgeons are operating, by placing cloths soaked in a low percentage of carbolic acid around the area, disinfecting the surgeon's hands using a weak carbolic acid hand wash, by submerging surgical instruments in a strong carbolic acid bath, and using solutions of carbolic acid spray to reduce the level of germs in the air around the patient. He also thought that metal should be used to make instruments instead of wood and ivory, as metal is much easier to clean. The procedures, along with the instruments that he invented, were designed to prevent germs from coming into contact with the open wound. This is also known as an antiseptic barrier. It considerably reduced the number of surgery-related infections. Even though ether and chloroform aren't used anymore as anesthetics, as they were substituted with much safer and more effective agents, they led to great developments in the medicinal field, and especially surgery. For example, Robert Koch's development of the aseptic technique, Gustav Nuber's use of sterile surgical clothing and easy to sanitize surgical equipment, as well as the invention of an autoclave, a machine that uses water pressure and heat to create superheated steam that kills microorganisms and spores, and Johns Hopkins Hospital in America's introduction of surgical gloves. This is how anesthesia and antiseptics paved the way for modern surgery.